taking the lives of over 270,000 people and having almost 3.9 million confirmed cases, COVID-19 has proven itself as one of the scariest, most dangerous pandemics of the recent years. With only having 13 countries worldwide without coronavirus cases, it's safe to say that the virus has spread around the globe and is sure to be remembered. Right now, you're living in a historic event that is COVID-19. Coronaviruses are a group of viruses known for causing disease in animals. The one we are facing now is a seventh of that family to jump the gap from said animals to humans. COVID-19 is so unlike when compared to its so-called predecessors, as the spectrum of disease is so broad. Many are carrying the disease while showing no symptoms, while many others are severely affected by it. This means it's even harder to pinpoint and control. Approximately 20% of COVID-19 cases are classed as severe, with a varying death rate between 0.7% and 3.4%, depending on location and quality dependable access to hospital care. As previously mentioned, coronavirus refers to a group of viruses, whilst COVID-19 refers to the one that we are currently suffering through. So, COVID-19, the CO meaning corona as it's part of that family, VI meaning virus, D representing the word disease, and 19 being the year it was first discovered, late 2019. The key thing to stop the spread and prevent new corona cases is staying indoors. You've heard it all on the news, on speeches, and it's true. Social isolation is genuinely the best preventative for any new virus. This, of course, comes with a cost. A study by YouGov questioned 2,221 UK adults under lockdown regulations and discovered that almost a quarter of them have felt loneliness. To keep mental health afloat, remember to try and stick to a routine, remembering hygiene and frequent breaks. This may seem tough, but having to deal with the grief of a loved one dying from such a preventable disease is even tougher. Without a host, the virus cannot stay alive. Of course, you can't recluse yourself forever and expect to live. In a public scenario, take precautions to keep as much distance away from others as possible and keep physical contact to a minimum, preferably using contactless payment. With social isolation brings an array of different, more difficult problems. A director of WHO's European region reported that the number of emergency calls made by women subjected to violence by their partners had risen 60% in April compared to April 2019. He then added, "With job losses, rising alcohol-based harm and drug use, stress and fear, the legacy of this pandemic could haunt us for years. So much related to COVID-19 has been unparalleled and is outside our control and understanding. But with solidarity, we can prevent violence from blighting the lives of generations. If you or someone you know is in immediate danger, call your local police. If you are not in immediate danger, the following numbers might be helpful. If lockdown rules are still in force, the virus will soon die down after a series of waves. Until then, keep up with your family, make sure morals are high, and most importantly, keep informed. We are seeing history unfold, so remember now. Remember the time we beat the enemy without a face. Remember the death of COVID-19.